Welcome back to the program. Well, have you ever wondered what exactly is a cold sore, a canker sore? Are they contagious? What causes them? What do you do about them? And can they be prevented? Well, those are just some of the questions that Dr. Thomas Dudney is here to answer this morning. Good morning.
Good morning, Nicole.
Okay, let's break it down.
Okay.
Canker sore, cold sore, same or different?
Different. A canker sore forms inside the mouth. It's in the soft tissues, the linings of the cheeks, the tongue, under the tongue, whereas a cold sore, also referred to as a fever blister, forms on the lips or in the nostrils outside the mouth. Now, when you talk about a cold sore, also referred to as a fever blister, it's a virus, a herpes simplex type 1 virus. And what's believed, the action of this, is that the virus lies dormant in the body. It can be, you can be infected with the virus at a young age, and it lies dormant in the body, and some type of episode causes it to manifest itself as the sore on the lip. And you usually see a little blister form, and then it starts leaking fluid out, and then it crusts over. This virus is contagious, and it's you have to handle it carefully. If you touch it, you need to wash your hands. You should always have your hands clean, and it can be transmitted to other people. That is contagious. Now, the virus is triggered, believed by, the reason it's called a fever blister sometimes is, say, a cold or having a fever or being sick, lack of sleep, poor diet, emotional stress. These are the things that they think trigger them. Whereas a canker sore inside the mouth, also called a mouth ulcer or an aphthous ulcer, is different. It's not virus related, and it isn't transmittable. In other words, it's not contagious. And these are much more painful. And sometimes people get multiple ulcers inside the mouth, and so they are believed to be caused by, can be trauma, as well as vitamin deficiencies, immunodeficiencies, and things like this.
What do you do about them? Is there over-the-counter medicine?
Yes,
I remember growing up for canker sores, Vince. Do you remember Vince? It's like a white powder for a canker sore inside your mouth. I remember seeing that.
Right. Well, there were different. The early treatments were like silver nitrate, which is, it cauterizes it. What it does, it kills the nerve endings, but they're very painful. So it's painful at first, but it doesn't promote healing. Corticosteroid creams, things like this, mouthwashes that have topical anesthetics in them for the ulcers. Some people just get one ulcer as a result of trauma. Say a sharp object, children that wear braces, sometimes the braces irritate the gum, brushing your teeth too hard can cause ulcers in the mouth. So if you just get one, it'll usually heal within a week to 2 weeks. If some people suffer from what we call recurrent aphthous ulcers, and this is a little bit more difficult to treat because they get them continuously, and that's where we look at things like vitamin deficiencies like vitamin B12, folic acid, iron. These type of supplements can help these people. It's also believed that there's a substance in toothpaste called sodium lauryl sulfate that causes the sudsing action of toothpaste. Toothpaste without SLS do help people that suffer from recurrent ulcers a lot.
So people have more questions about this. It seems like you could talk for quite a while about it.
It's a subject that you could spend a lot of time on.
Where can they get some more information?
They can call our office and we'd be happy to answer any questions.
Okay, Dr. Thomas Dudney, certainly thank you for your time. We appreciate it.
Sure, great to be here.
And don't be kissing anybody with any fever blisters.
With a fever blister, they are contagious.
Okay, thanks for the information.